Good afternoon, and thank you for joining the Downtown San Diego Partnership for this webinar on resources and plans to support the unsheltered population. I'm Betsy Brennan, President and CEO of the Downtown San Diego Partnership and moderator for today's discussion. As the voice and advocate for the revitalization of downtown, we know there is a tremendous need in our community in response to the COVID-19 crisis. Today's discussion will focus on the increasingly critical need to support our unsheltered residents, the highest concentration of whom live in downtown. The lived experiences of our unsheltered residents put them at particular risk for the spread of COVID-19. The resources many of them have come to rely on have been disrupted, putting additional stress on vital connections to services, basic needs, safe shelter alternatives, and housing. As a region, we have not been shy about our responsibility to step up, be creative, and do more for these residents. The Downtown Partnership is committed to do whatever we can as part of the regional solution. We have a committee dedicated to this issue, co-chaired by Bill Geppert and Steve Cushman. Our Clean and Safe Homeless outreach teams provide on-the-ground education, resources, and case management into housing for some of downtown's most vulnerable. There's more than 50 currently being served on a day-to-day basis by our crews. We have a lot to cover today, so if you have specific questions that aren't answered during this conversation, we encourage you to reach out to us at the email provided in the chat box today. A couple housekeeping notes for the format of today's webinar. We have received questions in advance during registration, and you will also have an opportunity to submit more Q&A as time allows. If additional questions also arise during the webinar, please submit them through the Zoom question and answer function. Question and answer will begin after we've had an opportunity to hear from our speakers. So let's get started. Today we start with Supervisor Nathan Fletcher. He is an amazing advocate for downtown and for our unsheltered population, and he serves as co-chair of the county's COVID-19 subcommittee. Supervisor Fletcher, take it away.
Thank you, Betsy. You know, it seems like it was a lifetime ago. We were convening the governor's statewide council on homeless advisors. We were talking about some potential really fundamental shifts in how we approach the issue of homeless. And we're beginning to see considerable progress in our coalitions and our efforts. And all of that was being done with a problem that is incredibly difficult and challenging, the one of homelessness. And then we layered on top of the difficulty of confronting the challenge we faced a global pandemic, the likes of which only happens every 100 years or so. And we've layered on top of that the accompanying economic recession and tremendous economic impact that we can expect for the foreseeable future. And so we've taken what was a very challenging problem that we were beginning to turn the corner on and potentially head in a better direction, and made it more difficult and made it more challenging. And so it's kind of in that environment that we're here to kind of update the steps around homelessness, primarily around the COVID response, and then talk briefly about some of the opportunities that could be ahead, that can put us in the strongest position moving forward. But I want to thank the Downtown Partnership, Betsy, you and your team, and all the work and efforts you do. A special shout out to Ketra Carter of your homeless outreach team, along with all of our providers that do this work day in and day out, whether we're in a global pandemic or not. Their job has gotten more challenging. It has gotten more difficult in this environment, and I'm so eternally grateful. We spend a lot of time praising our public health workers, and they deserve our eternal gratitude and thanks. But I really consider our homeless outreach staff, case managers, workers, providers to be in that same level of extraordinary individuals. And so we're grateful for your continued effort. I also want to thank the City of San Diego, the Regional Task Force on the Homeless, the Housing Commission, and the County of San Diego. If there was ever a time where we truly had to align and coordinate our efforts and move together, this has accomplished that goal. And so to the mayor, I'm very grateful, and his staff for their efforts. Councilmember Chris Ward, both as a member of the council and as chair of RTFH, Tamara, Rick Gentry with the Housing Commission, and all of our partners and providers. We have moved with a speed that is very uncommon in government, and sometimes it's a speed that can be a little disconcerting. Sometimes it's a airplane flying and we're still putting the wings on in terms of getting everything going. But when you look at things that traditionally take years are getting done in months. Things that take months are getting done in weeks. Things that take weeks are getting done in days. I think that we as a region have done a comparatively good job of responding to challenges of the homeless, understanding that the challenge of homeless was not created by COVID. It existed before. But we know that these are our neighbors and our friends, and we have to extend extra effort and focus to address their concerns and plight. We also know that given the impact of coronavirus on individuals with underlying health conditions, we know that our homeless are particularly vulnerable, both to the impacts of it, but also given the congregate nature of how many of them reside either in a shelter or in groupings, that it is also a great challenge and great difficulty. And so we've moved very quickly, collaboratively. When I say we, it is literally the city, the county, the Housing Commission, RTFH, the Downtown Partnership. We have all moved very quickly to try and mitigate as best we can the impacts of it. We've distributed more than 3,000 hygiene kits through our homeless outreach teams and our public health workers that the county has assembled, but we've relied on all of you to help. And those are 3,000 individuals who have been given at least some access to hand sanitizer, to soap, to water, along with vital information about how they can get help and support. We're presently sitting at 296 hand washing stations that were installed very rapidly. I know in the past there maybe haven't been as quick, but they were up, they're being serviced, they're being filled. Portable toilets have been set up and installed. I think one of the more positive things that we did early in collaboration with our shelter providers and with everyone was getting public health nurses rapidly into all of our shelters to screen for symptoms, to do temperature checks. Any individual that exhibited symptoms or temperature, getting that individual out of that congregate care setting and into a public health motel room where they can get further evaluation and prioritize testing. We also had public health nurses with homeless outreach teams doing the same in partnership with those teams and the great work that they've done. And then at the county, we moved very aggressively to stand up a large, about 2,000 public health motel rooms. We've been able to partner with our RTFH on about 447 of those that they can use for homeless individuals that are particularly vulnerable or not ideal for a sheltering type environment and situation. And so we continue to have those motel rooms available. They come with daily wellness checks that have medical personnel on site, that have food service, janitorial, hygiene, security, all of the things we need so that as we get an unsheltered individual or anyone in San Diego County who is a positive test, a person under investigation, which just means they're awaiting their test results, or in limited cases, individuals with symptoms who are waiting for their evaluation, who don't have the ability to isolate at home, we can provide that ability to isolate for them. And so we will continue to do that. We have also are starting daily reporting on the number of positives, and at such time, if it occurs, it has not occurred yet, a death of a homeless individual. We've worked hard at the county to break out numbers by jurisdiction, by zip code, by age, by gender, by race. And now we are breaking them out by their housing status. I just want to caution that the data that we share, just to put in perspective, comes from a multitude of sources. In America, we don't have universal one entity healthcare systems. We rely on a series of hospitals, of healthcare providers, of commercial labs, of clinics. And so oftentimes the data we get has to be assembled, verified, ensure that there's no duplication. And so we are doing the very best we can to provide that data in real time. To date, we've had 14 of our more than 2,000 positive cases have come from the unsheltered. Each of those individuals has received care in either a public health motel room or in a hospital. Upon discharge from the hospital, we will have a public health motel room available to them. And then we've worked out with our convention center partners how when they clear the public health motel room, they can be returned. At that point, we've assessed they've been safe. In order to clear a public health motel room, they either have to be retested with a negative test or have had 7 days past the onset of symptoms and 0 fever for 3 consecutive days. That's CDC guidance to say that you have cleared your COVID exposure and your ability to transmit that to others. The convention center work, and I know some other folks will test on this. And again, I want to give a special shout out to the RTFH, the Housing Commission, and the City of San Diego for organizing and executing that. At that, we have our county public health nurses who are there in force to ensure daily temperature checks and looking for symptoms. You know, the real danger is any congregate care setting, and we're having challenges with skilled nursing facilities and nursing homes. Any congregate care setting presents a particular challenge in that it's impossible to ensure physical distancing. And so the convention center was a great effort to take a bad situation and make it less bad by getting those individuals out of the sheltering situations where there was no capacity to physically distance and get them into a situation where they are physically distanced, but also into a situation where in a centralized location with physical distancing where you can ensure wellness checks, public health nurses that are there to check for symptoms, more appropriate and adequate case management. But we also have county teams down there who are working on mental health issues and substance abuse issues and getting people connected to services, perhaps in a way that we have not as effectively done as in the past when they were as dispersed. And so there's the opportunity to get better outcomes. And any time you have folks in a similar environment, there is, of course, a danger of transmission, which is why the adherence to the physical distancing is so important. And it's also important for us to keep in mind these are individuals who came out of non-physical distance shelters into an environment where they have physical distancing. That is a step in the right direction and a positive step. And then we've just are beginning to roll out in partnership, all of us working together with the Lucky Duck Foundation was able to secure additional testing capacity that was not in our region. And they're partnering with family health centers to begin today testing of individuals. And the aim here is to do a test of every individual at the speed possible for coronavirus. And we think we'll see what the results come back with. I will share with you that countywide, out of the 28,000 tests we've done, in order to get a test, almost all individuals being tested are individuals with very severe symptoms, many who present to a hospital. And for that population of folks, 93% are coming back negative, 7% are coming back positive. But the ability to proactively test asymptomatic folks will give us some insight into what is happening. And then we'll have the ability for anyone who tests positive to, again, immediately follow the protocols to isolate those individuals, get them into a public health motel room, and ensure their ongoing care and treatment in a non-congregate care setting. And so that is a really important step. And I'm grateful to everyone at the convention center who is working so hard to run and administer that place. In closing, the last thing I just want to say is that there are some opportunities coming out of this, both the opportunity to connect people to services in a way that maybe they haven't previously been, which can get them on a better path and potentially get them connected to a more stable housing environment. And there are other opportunities around the acquisition of things that may become more permanent sources of rooms. I know that there's a number of conversations that are taking place. I've been a part of a few about the opportunity to maybe purchase motel rooms. You know, some individuals who maybe independently run a motel are staring down 0 occupancy for March, 0 for April, 0 for May, not sure when it would come to a point that they may be back at an occupancy level. And so there could be a moment in time where we could come in and acquire some of those to provide some permanent ongoing options for housing. The city and county, we've been working on this pre-COVID, was the Behavioral Health Impact Fund. It was an idea I had out of recognizing that a lot of our service providers have ongoing revenue streams to provide services, maybe drug Medi-Cal or some other funding service, but they didn't have one-time money to buy a building, expand a building, acquire a building where they could increase the service. But if they had that one-time infusion of capital, they have the ability to provide ongoing services. And so we partnered with the city, county and city to take $25 million in disputed money in litigation, create an MOU that we are putting that money on the street now to service providers in the city of San Diego who have that ability to acquire a building, can show the service that they will provide, can show the ongoing revenue stream. We can quickly get that money injected. And I know that there's other similar efforts that are being coordinated. And so the hope would be that coming out of this, and we will come out of this, it is going to take us a while, but coming out of this, that with some intentional thought and effort and some real leadership on the part of all of our partners, that would really help facilitate a better outcome for these individuals. So with that, I will wrap up there, and I'm happy to stick around for a few minutes for any questions.
Thank you very much, Supervisor. Just personally really appreciate the leadership that you've shown, and your daily briefings are very informative. So thank you for doing that, and we look forward to seeing you on TV a little bit later today.
Thanks, Betsy.
With that, I would now like to welcome Councilmember Chris Ward. He represents District 3, which includes downtown. He's also co-chair of the Regional Task Force on Homelessness. The Regional Task Force is the lead coordinator for the introduction of new models and implementation of best practices for the San Diego region. We really appreciate your time, Councilmember Ward. And with that, your turn. And Councilmember Ward, unmute yourself, please. Oh, we're having a little bit of trouble with Councilmember Ward's audio. And we'll go to Keely Halsey, who's the Chief of Homelessness and Housing for Mayor Kevin Faulkner. So with that, we're gonna go to Keely, who's gonna unmute herself, and then we'll go back to Councilmember Ward. Thank you.
Hi. Thanks for inviting me to join you all today. You can see I come to you from the convention center. This is not the wallpaper that I have in my living room. We are here embedded with a team at the convention center working on the big project that Supervisor Fletcher just talked about a little bit, and that I'm sure you've heard about in the news. I'm glad for the chance to talk to you about what the city's done, the actions that we've taken to serve homeless residents under these difficult circumstances. So I'll share with you a bit about what we've done and what we have planned in partnership with the county, the RTFH, and the Housing Commission, who we've been working with every day. As COVID started to hit this area, we had to quickly rethink how to serve this population. And it was clear that telling people to wash their hands and stay at home was not going to be enough to protect them the way we wanted. Our shelters are a great resource to individuals experiencing homelessness, and they met CDC guidelines for congregate facilities, but we knew they weren't ideal because of social distancing. So we collaborated with Mr. Gentry's team on what we could do to provide better protections. They in turn worked with our shelters, and that's the bridge shelters, in addition to the brick and mortar shelters that we have in our city, on what we could do to provide additional spacing and isolation areas to treat people that became symptomatic. And the county graciously granted our request for public health nursing resources on site to detect and treat the illness as early as possible. But there was another issue looming in the background that we had to deal with quickly. Just as those of you listening likely have workplaces that are affected by COVID-19, the homeless service providers also were seeing significant impacts, both regarding availability of supplies and their staffing levels. So it became evident that we need to consolidate resources to be able to continue to serve people. And the city decided to take some additional proactive measures at that time. The first priority was to achieve better physical distancing for clients within our existing shelter system. To accomplish that, we at the city opened the lower level of Golden Hall as a new shelter space. That allowed us to invite individuals into that area for temporary relocation to reduce the density at our existing shelters. And in partnership, as part of that process, in partnership with the county and the RTFH, we were able to move the families who were at Golden Hall in the upstairs area onto individual motel rooms. But even when we had that capacity at Golden Hall, there wasn't enough space to provide that physical distance to all of our clients in the shelter network. To do that, we needed a much larger space. And that's where the convention center concept came into play. This public health prohibition on gatherings, while striking a tremendous blow to our local economy, provided a unique opportunity. And with that, we determined to temporarily repurpose the convention center as a safe shelter space. I just want to take a minute to say we've been so very grateful to have had Rip and his team as partners in that effort. We're very much appreciative of how the leadership and the staff have come together to work with us on this. The project is called Operation Shelter to Home, and it's a humanitarian mission. It's focused on creating that additional shelter space at the convention center, but truly it's a reworking and a reconfiguration of the city's entire shelter system to react to and manage the crisis. It's a huge undertaking, and we're treating it as the true emergency that it is. To carry it out, the city's using the Office of Homeland Security's Emergency Operations Protocols and the city's incident command model and structure. So those are the systems that your government has in place to take swift action in the event of a terrorist attack or a wildfire. And this is the level of emergency and coordination that the city is employing here. The project's driven by the expertise at the RTFH and is supported by City, Housing Commission, and county staff, as well as our service providers. Our service providers are embedded in the strategy development, day-to-day planning, and all the operational decisions being made here. That team is planned out. The physical setup, the site security, the food and janitorial services, housing navigation, medical care, behavioral health, you name it. And we've partnered with community organizations, such as through the partnership, through its clean and safe and family reunification teams. The system's set up to support the clients and the service providers. Over the course of a few days, I guess it was last week, but it seems like a lifetime ago, we moved over 700 people from existing shelters to the convention center, and then we reconfigured some of the other shelters in the system. For example, moving people with special health needs to the facility run by Father Joe's on Imperial because they have a dedicated health clinic on site. On last Friday, we began executing an outreach and intake process to bring people in off the street. So we now do outreach and enroll new people every day, and we're hosting multiple coordinated outreach events each week. We're able to offer this shelter option to more people each day. We just have to operate and perform that intake at a pace that our service providers can handle so that we have success. So to that end, we continue to supplement their staff and their resources with city staff who can pitch in to help to make it work. Currently, we have city staff doing all sorts of tasks here at the convention center, providing line safety to ensure that the clients and the staff are practicing appropriate physical distancing. And we have lifeguards doing some of that work, for example. And then we have a team of librarians here on site who are helping doing screenings and preparing reports that we need to make the operation work. So it's truly a team effort. And although we're taking care of emergency needs, we're also working on long-term solutions. Our strategies to move people into long-term stable housing have been considerably ramped up during that time. The crisis has created a few opportunities that maybe wouldn't have existed to us just a few weeks ago, as far as streamlining regulations and taking some creative approaches. So we're taking full advantage of those opportunities where we can. The vision is that when we come through this and get to the other side, that our entire system of homelessness is improved. So those efforts are driven all by a sole purpose. That's to prevent the spread of COVID-19 among our homeless population. It really is a remarkable partnership, an incredible thing to be a part of among government agencies and nonprofits. And we're all singularly focused on giving our homeless neighbors the best opportunity that they have to avoid this illness during this time. Thank you.
Thank you so much for your dedication, Keely. Just for people that don't work with Keely as closely, she's available 24/7 and we communicate with her quite a lot. So really appreciate your dedication to the city and to the unsheltered population. So thank you for being here. With that, I want to introduce Councilmember Chris Ward. He has his audio back. So with that, I'm going to have him unmute himself and go for it, Councilmember Ward. So happy to see you today.
Happy to see you too. And is the audio coming through this time? Do we have audio on this one, or give me a thumbs up?
Good.
Yes.
All right.
Clear. Thank you.
and I apologize for that. But Betsy and everybody at the partnership, I want to thank you for allowing me to be here today to engage with some of the rest of the community in the downtown area. We have had ongoing conversations with our planning group, with the East Village Association and the residents group over there. So this new virtual meeting format is really allowing us to make sure that everybody is feeling very current, because the landscape has really changed right out in the neighborhood. And I certainly recognize that. There's a lot of issues that have been presented in my office. Certainly we're working very closely with the mayor and everybody at the city, with the regional task force. As you all know, I serve as chair on that, with the partnership with the County of San Diego. This truly has been a collaborative effort, and we really saw that early on as we knew that this crisis was starting to about to come into our region. And as the city activated its emergency operations center, we wanted to make sure that we had a subset within that operations to address homeless challenges. And so hats off and kudos to everybody that's been involved with that. Lisa Jones, Keely, Molly Chase with my staff, Supervisor Fletcher and his team, because it has been that collaborative effort that's also allowed us to be able to really pool together and maximize some of the state emergency relief in a way that is really trying to direct that in a maximal way to help the most people. We know many of our individual providers have been challenged with their own staffing levels for some of their staff that have their own health concerns, some of their staff that otherwise are stepping back. So to be able to really serve the same population and hopefully a broader population while dealing with a challenged personnel flow, dealing also with the spacing requirements that is equally as necessary to afford our unsheltered and our homeless population just as much as it is to afford the rest of the general population. We wanted to make sure that we were transforming our systems to meet the need on the ground here today. Backing it up a few weeks, I think you all recall that the City Council ratified the mayor's state of declaration of emergency around March 17th. That also set a series of motion, the ability to have a rental eviction moratorium for both residential and commercial owners here. And simultaneously around the same time, we approved a local $6.1 million small business relief fund, also critically important to many of the small businesses in the downtown community that have been suffering and have had to temporarily shut their doors. We know we've had just an exceptionally high demand for that. So we are trying to get those responses out to those business owners as fast as possible. And we are asking as well others in the philanthropy community as of this week to be able to augment that fund and be able to stretch and reach even more businesses that have impacted while we wait for additional state and federal relief. At the risk of being redundant, because again, this has been a true collaboration with the two previous speakers, and what probably the detail you're going to hear from Lisa Jones in a second. You know, we have been making sure that we have been very effective at the function of the convention center, getting all of our individuals from the existing bridge shelters, from Father Joe's, from Alpha Project, from Veterans Villages, from Golden Hall facility, to be able to maximize that service and not just provide the same level of service, but also keep our attention really high on exit strategies to make sure that the housing navigation is not forgotten, that this is not just a pause in the landscape, but we are continuing to fulfill the primary function of what all of these facilities should be doing, and that is pointing everybody, getting them ready and assessed, and pointing everybody towards housing solutions. And now as we're able to actually expand the footprint as well to upwards of 1,500 total at the convention center, my understanding, and I have data as of yesterday morning, that already 89 individuals have come in, primarily from downtown streets, who want to get in, who want to get assessed, who want to get connected to case management and start the pathway themselves to be able to find housing solutions. So this can really be, as I think some of our previous speakers have mentioned, an opportunity to really help more. And at some point in the near future, hopefully sooner rather than later, we are going to begin to revert and scale back and come out of this emergency situation. And we want to make sure that we're thinking about thoughtful exit strategies, because what none of us want to do and none of us intend to do is to make sure that everybody from the convention center is sent right back out into the streets. So I've talked before that this is, and I think Nathan has used the phrase, this is like building the airplane as you're flying it, but we are simultaneously planning and acting and monitoring and thinking about the next steps at every step of the way, every single day. So to think that this is a phased approach, I know that there are many individuals, including myself and my team, that are thinking about phase 3 and phase 4. So our commitment is to make sure that we are helping people in the moment, that we are addressing some of the challenges that we are seeing on the streets constructively, that we are getting education and help and life-saving help out there to those that need it the most, and that we are doing our part to flatten the curve and to stop the spread for otherwise vulnerable populations. So we're going to continue to take that approach collaboratively, and I think together we are going to make sure that we have looked back on this time as having done everything in the best manner, given the resources and the circumstances, to be able to deliver the best impact and help for the downtown community. So thank you.
Thank you very much, Councilman Ward, and thanks for sticking around for some of these questions. I would now like to introduce Rick Gentry, the President and CEO of the San Diego Housing Commission. The Housing Commission is the public housing agency for the city of San Diego. They are the city's federal rental housing assistance provider and an affordable housing developer, investor, and lender. And Rick, just so you know, we do have Lisa Jones on the call too, in case you want to ask your Vice President to give any comments as well. So with that, Rick Gentry.
Thank you, Betsy, and I appreciate your having both Lisa and me here with you this afternoon. As most all of you all know, Operation Shelter to Home is the temporary repurposing of the convention center as shelter space for San Diegans experiencing homelessness. And as has already been pointed out, this is a partnership among the Regional Task Force on the Homeless, the City of San Diego, the County of San Diego, and also the Housing Commission, along with the regional homeless services providers that we work with in our ordinary homelessness programs. And this initiative has supported a broad regional approach to try to address homelessness during this COVID-19 state of emergency and to deal with the complications that have arisen. The Housing Commission's Homeless Housing Innovations Division, which, as you already mentioned, Lisa Jones's name is so ably led by Lisa, has been on site at the convention center since day one, and that's to support our contracted services providers, the homelessness providers, who we deal with on a daily basis, and also to work with our city, county, and regional task force partners on daily operations. In addition, the Housing Commission's Homelessness Division has implemented a dedicated housing navigation unit on site at the convention center. And this housing navigation unit is responsible for connecting shelter residents to housing interventions and securing available units in the region to move on to the next level. And this unit consists of both the leadership and staff from the Housing Commission's homelessness team, led again by Lisa, and also it includes the Regional Task Force's Coordinated Entry System team as well, to try to make sure that we're working in concert with regional activities. And the goal is to work with all the shelter residents and all the service providers to provide housing navigation, unit location, and other forms of assistance in trying to secure units, dwelling units going forward, permanent units, if you will, and also accessing the current coordinated entry system, which will locate housing resources with the support of the system's matching team. I'll also point out that the Housing Commission and Regional Task Force have developed an exit strategies resource unit that consists of staff from both organizations. And this unit is dedicated to tracking and acquiring funding that can support new initiatives and scale up current successful programs. This unit will source available funding opportunities, recommend new interventions, and develop policy recommendations for regulatory waivers or exemptions to certain restrictions on federal and state regulated funding sources. And hopefully these policy recommendations will result in an allowance for broader flexibility, streamline current processes, and to develop more innovative approaches going forward. And let me just mention 2 or 3 items that we're currently working on in that endeavor. And one, as you all, anybody who works with the feds understands that the federal rules and regulations, although designed with good things in mind, can simply wind up being some of our biggest hindrances in making this program work. And one of our problems lately on the Housing Commission side is trying to make the Veterans Affairs Supportive Housing, VASH, or VASH housing, work better. And as you all know, the Housing Commission has a set-aside of about just over 1,200 VASH vouchers, and those are in addition to a part of the 15,500 vouchers that the Housing Commission currently operates. Our ordinary vouchers currently have a utilization rate of 100% constantly. The VASH set-aside, however, has some significant underutilization, and it's simply a bureaucratic snafu where we're unable to get sufficient referrals from the local Veterans Administration. It's a capacity issue. And we've been focused on trying to get HUD, the Department of Housing and Urban Development, and or the Congress, depending on who will willing to take action, to free up those vouchers for us to do a more streamlined usage. I was actually scheduled to give a presentation before a housing subcommittee in Washington, D.C. on March the 10th, just last month. Well, you know what happened, and for very good reason, I did not go, and was probably for the best. We had Congressman Peters to step in for me and do a much better job of doing a presentation on trying to free up those vouchers from a process that was designed that in ways that's not working very well for us. So if we can, if this current crisis can be used to break free those vouchers, then that's a small silver lining that we should not overlook. We're also have a request into the feds to do on the permanent supportive housing waiver to open up programs for roommate sharing as well, which are currently prohibited under most of the rules that come out from the federal government. So we're looking at a number of options there to try to make better utilization of what we've got already. Also, a final one, Betsy, I'll point out before giving the podium back to you, is the Housing Commission is also looking to what I call the tertiary stage of this of the set of issues. The primary, of course, is getting people off the streets. Secondary is making sure that folks are housed in a safe, decent setting once they come off the streets. The third is what we're looking forward to is the exit strategies into permanent housing. And something you all will hear more about in the coming days. The Housing Commission is exploring right now the possibility of doing a leasing with the potential for acquisition of hotels and motels throughout the area. Now, this is very preliminary. My board has not even acted yet. I'm sure there are going to be questions about it, and I will give very limited but not very deep answers to. But if we can turn this crisis into an opportunity to expand our supply, then I think that would be an ideal tertiary solution to what is now a terrible problem. And Betsy, I'll turn this back to you, and thank you very much for having me.
Thank you very much, Rick. Really appreciate all the panelists today. We have more than 130 participants on the call, and people have submitted quite a few questions. We're going to try to get through as many as we can. I'll direct each question to one of you, and if somebody else has something to add, please do, but otherwise we'll go to the next question after that. So the first question is for Supervisor Fletcher, who ended up being able to stay on the phone for us for a little while longer. So Supervisor Fletcher, I want to make sure you're there and can hear me and can respond. We have a question from Joyce in Cortez Hill for Supervisor Fletcher. And that is
hi, this is Haiti with
hi.
He actually had to step out, so okay. If you want to maybe put it towards the end and then maybe he can come back. I'm checking to see if he's coming back.
Okay, no problem, and if not, we can follow up with you afterwards. That's totally fine. He told us he wasn't going to be able to be there, and I just saw that he was still on. So anyway, I'm going to go to Councilmember Ward now. So Councilmember Ward, this question is from Don for you. He's concerned about some of the unsheltered population on C Street, and he's wondering if the C Street population might be able to be prioritized for convention center use.
Well, I think that I'm concerned with, regardless of exactly where individuals are, all of our unsheltered population. And yes, sometimes that congregate both presents health challenges to themselves if they're not really socially distancing, but also can be a place where either crime turns its attention toward, whether we've got drug sellers out there that are trying to prey on our homeless population. We want to make sure that we are reaching everybody out there simultaneously to the best extent that we can. And again, thanks to the partnership of the partnership's clean and safe team, as well as our own homeless outreach team and all of our service providers, we are trying to really do that constructively with this convention center as a home base. I would say that if there are any active crimes that are being committed, or there is a particular challenge that you would want to bring to the attention of PD, please do call that in, whether it is a 911 or a non-emergency line. Certainly use your discretion. We want to make sure that we are keeping the neighborhoods and the incidences out there safe. And we're going to, again, it's not just a downtown area. We need to have that outreach in Hillcrest, in North Park, in Ocean Beach, and many of our communities. The convention center is a regional asset. There have been a lot of pooling of the resources to be able to help more individuals and reach them where they are. So we want to make sure that we are treating it as such, and not, to turn any attention away from the downtown or any area within downtown, but we're trying to get to all places simultaneously.
Great, thank you very much. The next question I'm going to direct to Rick Gentry. And Rick, Nancy from Hill is asking, what is the construction plan for the Cortez Family Center, and how long will it take? And you might need to give people a 30-second explanation of what the Cortez Family Center is.
Betsy, I'm sorry you were coming and going. Can you repeat the question, please?
Oh, sorry about that. Nancy asked the question, what is the construction plan for the Cortez Family Center? How long will it take? And you might have to give a 30-second explanation of what the Cortez Family Center is for everybody else on the phone.
Yeah, the Cortez Hill property is on Cortez Hill, hence the name. It's been in long-term use as shelter housing, but mainly for single-parent households with kids, primarily mothers and children. And that's a property that the city owns, and that the Housing Commission is in negotiation with the city right now over acquiring it from the city and rehabbing it. We vacated the property earlier this year because it had developed some significant physical issues, and we felt it was not safe to be habitable any longer. So we vacated the property, moved the families that were in there into other housing. Nobody was put back on the streets because of it. And the property is going to require some significant construction, reconstruction. It's not going to be a small rehab, it's going to be a big one. So I suspect it will be at least a year before that property is back in operations, and perhaps longer.
Thank you, Rick. This next question is for Keely from Katie. She asks, how can her business support your efforts with locally made products like hand sanitizer or other personal protective gear?
Hi, thanks for the question. We have an entire logistics team here that's dedicated to procuring the supplies that we need. And although we're in good shape across the board now, we're of course looking long-term, so those offers are much appreciated. The city has just set up in the last few days a website that is intended to sort of consolidate those offers and then also communicate back out to the community what the needs are, because we turn around and ask our service providers, what can we help you get to do your job better? So that website is sandiego.gov/donate. And that would be the best place to go see. It's just up and running. I haven't checked it out myself in the last day or so, but that's going to be where we put out requests, as well as have a pathway for people to make offers. So thank you very much for that question. That's generous of your listener. Thank you.
Thank you. And we'll make sure we put the contact information in the email that goes out after this webinar as well. This question's for Councilmember Ward. And the question is about family intake. Is there enough room for families that need to stay together and be housed?
So families are specifically being one of the subpopulations that qualify for hotel vouchers. And so there are no families that are going to the convention center, but we are, if any do approach that facility, we are trying to redirect them to the place where they can actually stay together in an isolated unit of that type.
Great, thank you very much. This next question is for Rick Gentry. And Rocio asked Rick, I have clients who are currently receiving assistance who are not able to access residential treatment facilities to address substance use. Currently, they can receive temporary housing to prevent them from being homeless. However, the services needed for their underlying conditions are not available. Are there ways to have substance abuse services available now and that case managers can assist clients in obtaining help?
I'm going to ask you to unmute Lisa Jones. Lisa, if you would address that one, I would appreciate it.
I think I'm unmuted. Am I unmuted?
Well, Lisa, we can hear you, but it's very faint. Could you talk a little bit louder?
Hold on one sec. I'm just going to come over and speak from my screen. I just need to get up and move 6 feet away.
Thank you.
She's very kindly not putting me on the picture because I'm not as well attired as she is today. So my understanding is the question is for folks that have higher needs in regards to substance use disorder treatment and things like that, that may need more than what a convention center facility and or what a temporary lodging facility might provide. Is that correct?
That was my understanding, Lisa.
Thank you. So we've done a couple things. We've actually had some really good partnerships coming from the Department of Behavioral Health. So behavioral health has committed to having some folks from their outreach teams that have a daily awareness of the available beds within the different behavioral health programs that the county supports throughout the region, so that when they're encountering someone in a coordinated outreach event or in another capacity such as that, that they are making sure that they're connected to the best intervention to meet their needs, and that also is an intervention that they are choosing to move towards. We also have the same ability to connect folks through that that are identified in other ways. So it really is a partnership with behavioral health, bringing those resources in and them having a daily awareness of all the different beds and interventions that are available within their system.
Great, thank you very much. This next question is for Keely Halsey. And the question is from Wendy, and it was specific to Father Joe's, but I think this could apply to all service providers. Are all the service providers taking precaution regarding hygiene? I have quite a few clients with a couple concerns about hygiene at different service provider locations.
Absolutely, all of the service providers with whom the city contracts for services have received through the work of the Housing Commission, we communicate with them about the directives that have come from the county with regard to enhanced cleaning procedures. And we've also worked with them to make sure that they have the supplies that they need to do the work. Here at the convention center, they do cleaning as well as the janitorial staff on site. So our procedures are certainly heightened during this time.
Thank you very much. The next question is for Councilmember Ward. And the question is from Gary. Did I hear correctly, San Diego is preparing for a large homeless population in the coming months? What percentage of the population is expected to be homeless in the next 12 months as compared to last year? And I'm not sure you can answer that in specifics, but you might have a comment to it.
No, we have no reason to believe, first of all, that there's going to be an influx of homelessness. But what we do know is that because so much homelessness is rooted in economic conditions, that the stress that people are having from loss of income or otherwise being able to meet their rents is going to put some pressures on particularly families, but others that are on the margins and might be at the risk of falling into homelessness. And that is absolutely what we're trying to prevent, what we've always been trying to prevent through many of our diversion programs. We are going to be keeping the course on, in fact, if anything, I think having a greater attention to some of that, the fact of that, and make sure that we are accessible and helping those that otherwise might be falling into homelessness.
Thank you very much. The next question I think could go to Keely, but if others feel free to jump in, but it's actually from someone named Keely, to Keely. And can you tell us the times and locations of the planned outreach events, like the one that was held this morning? With libraries closed, where can unsheltered people use the internet or a telephone to apply for IRS stimulus payments?
Okay, I'm here now. Sorry about that. So the outreach events are being coordinated. There were the two this week, so those will be posted through our network, our existing network, so that we have, if the service providers who are on the call are familiar with the events that the homeless outreach team in the neighborhood policing division regularly convene, the news and the announcements about those will go through that resource. For those of you who are not familiar with those events, they typically occur on a weekly basis, and we're ramping those up through this time in order to get outreach to different communities. With respect to the other issues you raised, I don't think that I have a satisfactory answer as to where all of those resources can be achieved, located and provided at this time. We're aware that I think the requester mentioned charging stations in particular. And so that is a particular challenge because of the requirements with regard to social distancing, yet it's a primary way that we have to allow for individuals experiencing homelessness to get the information that we're trying to put out. So we are working on a few solutions. I don't know that I have anything concrete to be able to share with you today, but we are aware of that and are really working through our boots on the ground outreach workers in order to deliver those important messages. And that's our service, that's our homeless outreach team, that's our service providers, it's our county social workers, it's PERT, it's our entire network.
Thank you, Keely. This next question is for Councilmember Ward, and this will be the last question to each panelist. So after you answer this question, if you have any wrap-up comments, that would be a great time to do it. So for Councilmember Ward, this question is from Serving Seniors, and you've been a major for our senior population. And the question is there discussion to continue to have a senior-only shelter post-COVID?
Great question. We have not had that specific of a conversation around the senior population. We are certainly mindful of those that are over 65 and have underlying health conditions. They also specifically qualify for priority hotel room placement as well. For those that are on the margin, anybody that's really 55 or older, and we know in the last year we've also seen the last year's data from 2018 through 2019, an increase in unsheltered senior populations as well, that they're going to come with, I think, a certain set of support needed that also is going to be provided for at the convention center. We've got some great partners between our three major operators who are now all really, I think, aligning their resources and trying to make sure that they're spreading the love across that entire population there as well. So I have full faith that they know how to deal with some of the specific issues for any senior clients that may be a part of that population as well. With that, I have no specific and further comments. I think as far as a closing, I saw we had over 130 participants here, which I think underscores how strongly of a community we have down here that cares about downtown success, and even in these really challenging times is really committed to do their part as well to somehow help get through the moment and really make sure that we haven't lost any progress on where we want to be headed, the vision that we have for downtown. So I share with you in that. Our office is always open. My representative, Brittany Bailey, my chief of staff, Molly Chase, and others are really a phone call away, an email away to be able to help immediate needs that the city can be able to facilitate, but also do some medium and long range planning to make sure that we come out of this crisis stronger than before. Thank you.
Thank you so much, Councilmember Ward. Really appreciate it. Next question is going to go to Rick Gentry or Lisa Jones. And I will say that if we don't get to all of your questions today, we will try to get them to the panelists and get you the answers that you need to your questions, because these panelists are amazing and they have good teams, and we'll try to answer as many questions as we can after this webinar as well. So this last question for Rick and Lisa, and then any wrap-up comments you might have. How do homeless populations in Oceanside, Ocean Beach, Pacific Beach, etc., get access to the convention center? Is there transportation options available?
Lisa, I'm going to punt that one to you, please.
Okay, she's right here. Hi, this is Lisa. So I think that's a great question. It's something that we've been talking about on a regional level. As most of you are aware, people generally have some form of geographic home. So they have an area in a community where they feel connected, where they understand the resources that are available. We very much understand that there are diminishing resources within the community, but the regional task force is working very diligently with other communities within the region to make sure that we try to find interventions where people get to connect in a place where they're more likely to stay stable because they're used to the resources and the environment that they're in. And that if they're not able to do that, then connecting with the outreach process that we already have in place, that proven process through the bridge shelter networks and outreach workers that we've had before. RTFH is also currently standing up a contact for coordinated outreach for every region sort of within our county jurisdiction. So a North County, an East County, a Central, a South County, to make sure that people can get connected to resources. So I strongly suggest that people continue to look on the RTFH website for more information that continues to come out.
Thank you so much, Lisa. And Rick, do you have any closing comments? And then I'm going to go to Keely for questions and any closing comments Keely might have.
A positive comment about how remarkably well the regional coordination has been in this effort, and how well people are working together. In a lot of respects, a lot of the issues are going to be particular to neighborhoods and communities and cities and towns throughout the county, with the city of San Diego, of course, being the largest. But the regional task force has a focus for coordination, has a focus for information, has a focus to help understand selection of homeless to come into the programs. I cannot overstate the value of the regional task force. So I refer people back to that task force for information, and to the Housing Commission as well on the programs we directly operate, and also with the way we can connect people to programs and operations that might be outside our jurisdiction. Thank you, Betsy.
Thank you very much, Rick. And this last question is for Keely, and it's kind of, I've taken some questions and put them together. One was from Nora, one was from Jerry, and it's about how do we direct people that would like to get into the convention center? Is there a organized way in which people need to approach being entered into the convention center?
Thank you. Yeah, during this time, the only pathway to the convention center is through outreach. So there are no walk-ups or walk-ins or drop-offs permitted at the convention center at this time. That's for the safety of the residents and in order to, as I mentioned before, work with the providers to make sure that we're doing intake to a certain number of people each day in order to keep up with their staffing and supplies. Again, supplemented by city staff. So we're ramping that up every day, but we do need to maintain that. So the pathway to the shelter beds at the convention center is through outreach. And if you want to connect a particular individual to outreach, just as in normal times, it would be a good first step to call the hot team. And so their phone number is 619-446-1010. That would be the next, that would be the best first step in order to ensure that we're focusing our outreach teams in the right areas and to the right to individuals in need. And I don't have any closing comments except to echo what the other panelists said about the collaboration. There are a lot of very dedicated, very smart people working on these issues, and they're complicated and incredibly important, but there's a very, very good team behind this effort, and I'm happy to be part of it.
Thank you so much, Keely, and thanks to all of our panelists today. As they all mentioned, it's a collaborative effort. They're leading the way, but there's many, many public and private partners, from internet provided by Cox to SDG&E helping with not turning off people's meters. So there's things happening all over the region that we're really, really appreciative about. We will, again, try to get some of these open questions answered by the panelists and also do a wrap-up email. We're making a recording of this webinar, and it's going to be available on demand on our URL, and that'll be given out in the email as well. And our next webinar will be, we'll be promoting a webinar by the San Diego Chamber of Commerce and Lead San Diego, which will be on Wednesday, April 22nd from 2 to 3 p.m. And it's a focus on leading teams and families through these unprecedented times. If you have ideas related to today's topic or for other resources that would be helpful for you, please feel free to contact us, as we want to be a resource and helpful to the people participating. Stay safe, stay strong. We look forward to working with all of you together in the future, hopefully in person. With that, have a wonderful day. Thank you.